What do you think it's really going to cost, Avik, ultimately, when this is all said and done, per person to have this health care?
So I ran the numbers last night on what the Department of Health and Human Services put out, and it looks like for the average guy on the exchanges, premiums will go up by, the underlying cost of insurance will go up by about 100%, 95 to 99%. For women, 55 to 62%. That's the underlying cost of premiums before the subsidies go into effect.
So costs are actually going to go up. This is
costs are going to go up.
To stem costs, and that's because the government
is
involved, or what's the rationale?
Imagine if Congress passed a law requiring all cars to have a hybrid engine. We might think that's a good thing because of fossil fuels, but cars would be more expensive because hybrid cars cost more. It's the same thing with insurance. So Obamacare is forcing the insurance product to be designed in such a way that has a lot of bells and whistles that make the insurance product more expensive.
I mean, the White House is saying it should cost roughly $3,000 on average per person. You don't buy it.
Well, yes, but that's a lot higher than what people will pay today if they were shopping for coverage prior to those regulations going into effect.
You know, Dr. Partis, I know we've spoken before, and you are very much of the mindset that this is a good thing overall and has the potential to bring health care costs actually lower?
Absolutely. Look, we've been trying to fix health care in the United States for a long time. We've got God knows how many people who are uninsured. If they're uninsured, they cost us more. And so we've got to fix it in one way or another.
And you think this fixes it?
No, yeah, this fixes it. I think this is a very good move. That doesn't mean it's perfect, but it's good. And
ultimately lowers costs?
Yeah. I think Adam could come out with any kinds of numbers. He produced a paper that I've never seen before, so if I get a chance to look at it, I'll tell you what I think of it. He doesn't include all the states in there, as I looked at it quickly. I had 2 seconds to look at it. But that isn't the point. We've got to do something about making health care better in this country. And the reform that we're doing is going to make it better by recovering more people, by pushing for better quality, and the costs will be reduced.
You know, some people are concerned, sorry Adam, but some people are concerned that they may not be able to afford this. You know, there's a mandate that you have to have it. Well, what if you don't have the money to pay for it? The president actually pointed out in a discussion last night with former President Clinton that you don't need to worry if you can't afford the care. Listen to what he said.
We're saying, if with the better deal that you got, you still can't afford it, we're going to give you tax credits to essentially subsidize your purchase of health insurance.
What he's saying, we're trying to help a lot of people by giving them the tax credit if it's too much for them. For some of them, they can be a penalty and get out.
It's first of all, it's a nice sentiment to say that, but it's a small minority of people who are going to benefit from the subsidies enough to make up for the fact that the cost of the underlying insurance product is so much more expensive. So we did the analysis at the Manhattan Institute. What we found is that for the typical person of a median income, they're going to pay more under Obamacare than they did before. You have to make about 50 to 60% of the median income, so much lower than the average income for those subsidies to kick in.
Meanwhile, you've got people with deadly illnesses who can't get health care and are tragically trying to find it wherever they can go. We've got to do something about it.
Let's help them, but let's not spend another $1.3 trillion over the next 10 years to do it. Let's make the system more efficient.
You're overstating, and you can play with numbers.
That's the Congressional Budget Office.
Send me your paper about a month or two in advance. I'll come back to you on numbers.
Is the system actually fair? I mean, when you break it down, it looks like it's going to depend on what state you're living in, how much you're actually paying. These exchanges really do vary quite wildly state to state. So if you're in Florida and that's a big market, you might get a better deal. If you live in New Hampshire and it's a small market, not such a good deal. What can be done to create a more equitable system so that people in New Hampshire or in Rhode Island get as good a deal as, say, California?
Well, just to point out, in New Hampshire, actually, because New Hampshire already had a heavily regulated market prior to Obamacare, New Hampshire's rates are actually going down slightly because they're already so expensive. Florida's will go up because it had a more lightly regulated market pre-Obamacare. The way to think about it is how regulated was the market before Obamacare and how much regulation does Obamacare add. There are a few states where they're already heavily regulated, and so those states will either go down or be the same. It's the states that are lightly regulated, states like North Carolina, where rates might even triple or quadruple.
Can you not just have a system where it's across state lines?
You cannot make the country perfect in every regard. There are massive differences in terms of costs from state to state.
But why do you have to purchase it in state? Wouldn't it make more sense to just open the market up entirely?
That may be a legitimate question to ask. But right now, the idea is to get people covered. And think how many presidents have tried to do this, and finally we get up to the point where we've got something to spend our time and possibly stop the government from functioning in order to get this thing reduced is simply ridiculous.
One of the other big worries.
If we're bringing in 40 million people who didn't have coverage before, isn't it, again, by definition, going to be more expensive?
You've got to, at the same time, do things to cost reduce. What we did in the hospitals is we said we would help. We would take $155 billion out over the next 10 years. We are doing it. At New York Presbyterian, that's costing us $1 billion, and that's being taken out as we speak.
Okay, here's my other question for you guys. Are we running the risk of creating a two-tiered system? Because
we have kind of a six-tiered system, actually. We have Medicaid, which provides really, really bad quality care to people at the lowest end of the spectrum. We have a good system for people who have employer-sponsored private insurance today and a lot of other things in between. But the thing is, why are people uninsured? People are uninsured because insurance is too expensive. And then Obamacare comes in and makes it even more expensive. That doesn't solve the underlying problem.
Let me agree with Adam on one thing. There's going to be a tiered system. I disagree. To say that Medicaid gives bad care is a very absurd statement.
It's the New England Journal of Medicine publishes all the data.
Kind of care. There are problems in making care perfectly in all the systems. The idea is to try to make sure we start with at least having people covered. Can you stand there and watch a person dying of cancer and can't get treatment because they don't have coverage? We've got to do something about it. And we're not dumb. We're looking to try to cut costs at the same time.